Good afternoon and welcome to Webinar Wednesday. We're excited about today's presentation featuring expert Micha Burd, Product Vice President of Cynerio. Micha will discuss how biomedical/CE teams and their IT counterparts can tackle the challenges of securing medical and IoT devices quickly and safely with a zero trust strategy while ensuring patient safety, data confidentiality, and device availability. Webinar Wednesday would like to thank our sponsor, Cynerio. Healthcare is Cynerio's only business, and its mission is simple: protect healthcare's weakest link to ensure patient safety, data confidentiality, and service availability. Their full suite healthcare IoT cybersecurity platform automates end-to-end continuous asset discovery for every connected medical IoT device and OT system in the clinical ecosystem. They view cybersecurity as a standard part of patient care and cover every threat vector with proactive and preemptive attack prevention tools, automated risk reduction, threat mitigation, and step-by-step remediation programs built on the NIST Zero Trust framework to get healthcare facilities secure fast. For more information, please visit cynerio.com. A few announcements before we get started. Please join us for continuing education, networking, and vendor engagement opportunities at our HTM mixers over the next few months. We'll be in Milwaukee on July 14th and 15th, and in Kansas City on September 9th and 10th. Please visit htmmixer.com for details, registration, and our steps to a safe and clean meeting environment. While you're there, please register for our newsletter to have the most up-to-date information. Let's give one lucky attendee the opportunity to win a Webinar Wednesday t-shirt by answering the following question. Cynerio has been listed as a top-ranked leader in medical device security by what organization? You can find the answer by visiting our sponsor's website. Please use the questions feature on the GoToWebinar dashboard to submit your answer. As always, today's webinar is eligible for one continuing education credit from the ACI. You can obtain your certificate by completing the post-webinar survey. More details on this at the end of today's webinar. We'll wrap up with a live Q&A session. If you have any questions, please submit your questions using the question feature on the GoToWebinar dashboard. We'll get through as many questions as time allows. As I mentioned earlier, our speaker today is Micha Burd. Micha, you may begin whenever you are ready.
Great, thank you very much, Jennifer. Hi, everybody. So let's start. 1 second. Okay, let's start. So my name is Micha, and I'm the VP Product of Cynerio. I've joined Cynerio 2 years ago, working on this new solution, which is doing what I love to do and finding my passion in new markets using cutting-edge technology and understanding the customer pains and trying to find the solution for them. So you can see that I'm doing that also in my private time as well, finding my passion. So what have I prepared for us for today? A little bit, just a high level of things that we will cover during the webinar. So we will go a little bit and understand a little bit the background regarding medical device security. I think it's important to understand the risk out there and what we need to expect. I want to focus on the things that you can do in order to mitigate the risk. It's not good just to understand the risk. We need to understand what can we do about it, which will lead us to the zero trust concept. That means that what are the things that we really can do to mitigate the risk using the network. We will get to that. And I hope that I would be able to provide you the knowledge and give you some tools and share language to work with your security team and network team in order to mitigate security for medical devices. And if we have time, I hope that I can show you a short demo of our solution. Jennifer, so we'll start with the first poll questions, which is something that really interested me and want to hear your thoughts about it. Is like, in your organization, what is the expectation from the biomed team regarding medical device security? A, the biomed team owns the security of the medical devices. B, the biomed team role is to provide just guidance in regarding to medical device security. C, the medical device security is shared effort of the biomed team and also the security team. Or D, the biomed team is not responsible for the security threats of medical devices. Jennifer? Let's take about 10 seconds and I'm curious to see your answers. I think we can wrap up. Great. I was expecting this answer. So device security is a shared effort of the biomed team and the security team, 62%, which is awesome. So probably you've seen some kind of this slide before, giving you high-level numbers of the security issues for medical devices and how dangerous is it for the organization. So it's so dangerous that even the FBI, the FDA, and also the Department of Homeland Security were actually issuing, like months ago, warning about it, and the numbers are really high. I didn't want to give you just the high numbers because I thought it will not convey the message the way that I want to convey it. So I actually, and this is something that I love to do, I love reading information regarding security attacks. One of the reasons is that I want to learn how the attackers are thinking and what they are doing. And the other things, I want to hear what those hospitals, the teams that need to handle this kind of attack, what they did and what was the lesson learned from their perspective. This is something that really helps understand the pain of the customers. So this slide is not a wall of shame. I just wanted to give you the perspective of how this is a hospital that got hit by a ransomware in 2020, and this is only the last quarter. You can see the numbers, and they are high. In one of the podcasts that I was listening to, one of the CISOs were asked, if you need to give an advice, suggest to other healthcare provider what they need to do in order to prepare for such an event. So I love his answer because I think he summarized it really well. He said, the question is not if you'll get attacked, the question is when you will get it, you will be attacked by a cybersecurity attack, and will you be ready for that? And I think that summarized the point that I wanted to actually convey. So what are the damages that are expected from a hospital that is being hit by a ransomware attack? So first of all, usually all the systems are going down it takes about 3 to 4 weeks to restore the systems, and the hospital reverts to work with papers. The ransomware, again, understand that sometimes hospitals do not want to pay the ransomware fee. So they are not only blocking all the system in the hospital. Before they are doing that, they're actually leaking out all the PHI that they can put their hands on, and they are threatening the hospital that if they won't pay them the ransomware fee, they will take those records and sell them in the dark web. I don't know if you know that, but medical records on the dark web are worth 10 to 100 times more than any credit card information. While the hospital is being attacked, you cannot admit any new patients. And also all the treatments, all the medical treatments are being delayed because no physician will do any treatment without the ability to look into the patient records. And the problem with that, it's not just that the hospital that has been attacked cannot give treatment. Those patients cannot go to a different hospital and get treatment because even in the other hospital, they need to show their medical records in order to get the treatment. And they are actually blocked, or they cannot get any treatment until the hospital is able to recover. And just to let you know, 2 days ago, I've read that Scripps Health, which is here on the list and is right now recovering from attack, is now flooded with lawsuits from patients that were not able to get treatment, medical treatment. And just 2 days ago, I read about the Georgia healthcare system that also, like a few days ago, were being hit by ransomware. So the point I'm trying to say, you need to be ready. In some time, you might get attacked as well, and you need to be ready for that. And why is medical devices is so important when we're talking about ransomware attack? So medical devices are really susceptible for attacks, and you probably know that you are actually handling those devices. You understand that, you know that their life cycle is really long. They're running old operating system. It's really difficult to patch them if there are patches or there are no patches at all. And they are not, when they were the manufacturer of the device produced the device, it never thought about security. It was thinking more about patient care and patient treatment. And I don't want to talk about the things that you already know. Let's talk a little bit about a real use case that we've experienced, that I've experienced with one of our customers. So we had a customer that his nuclear medical device was communicating to a command and control server over the internet. Our solution detected that. And the security, and this device obviously runs a legacy operating system. And the security member that saw this communication was actually wanted to take the device down. He wanted to disconnect the device from the network because he was afraid that the malware will continue spread across the network. But the PAX team refused to take the device down. The device was too critical. They stopped the security guy from taking off the device. So the only thing that they could do, they went into they addressed the vendor and asked the vendor, what are the things that we can do? And please help us remove the malware from the device. And the vendor refused to help them. He said, this system is already not supported, and I cannot help you with anything. You need to deal with it yourself. And since the device is so expensive, replacing it, it's not something that they could do in a really short time. And the only thing that the effective thing that they were able to do is actually limit the device communication to make sure that in case to only allow the device to operate without doing any other communication in order to mitigate the ability of the device that the malware will spread to other devices in the network. Which lead me to another question which I would like to learn from your experience. Do device vendors help with removing malware from medical devices? A, yes, the device vendors helps us fix and restore devices running legacy OS, although it was not covered by the SLA. No, the device vendor, B, no, the device vendor refused to help fix and restore the device. And C, the device vendor only helps if it's covered by the SLA. Jennifer, can you show the poll? Let's wait for 10 minutes, for 10 seconds and close it. Okay, the device vendor refused to help. So I have the same experience as you had. It's not surprising. So we understand there is a big risk around those devices and we need to take care of it. And let's talk a little bit about the basics. What do we need to do in order to mitigate and to be ready for this ransomware before it attacks us? So obviously the first thing that we need to do is to build the inventory of all the devices. You cannot protect things that you are not aware of. You would be surprised. Some of our customers, once we've connected our system and started seeing all the devices on the network, we even find devices that the biomed team thought they were lost, and we were able to find them. So finding the devices is critical to know exactly what you have. Even from maintenance perspective, probably as biomed, you know that you need to keep doing some maintenance work, regular maintenance work on the devices. And if it's marked as lost, you don't know about it and you don't treat it. So building the inventory is the first thing that you need to do. The second thing that you need to do, once you know your inventory, you need to do a risk assessment on the devices. And this is not usually easy. Usually there are systems specifically for building risk assessments. And in the cybersecurity space, there is a standard of how to calculate specific risk, how to quantify, to give a number, to give a score to a specific vulnerability or risk on a device. And this is, there is a calculator that's called CVSS that is being used for that. I will not get too much into details. I don't think this is the webinar is not about how to calculate the risk, but now once you have all the vulnerabilities mapped to all of the devices and you're calculating the risk, you actually at the end find yourself in the state that you have a long list of risks and each risk have a score. And now you need to start prioritizing your work, what type of risk you would like to first remediate or mitigate. And you want to make sure that you, first of all, do all the low-hanging fruits first to remediate as much as you can. And from my perspective, there are actually two approaches to do that. So I call them bottom-up and top-down. Let's start with the bottom-up. Bottom-up is actually taking all those risks and those scores and start just sorted by the severity, the biggest number first, and then go one by one. The problem with this type of approach is that you have many vulnerabilities which are with high severity, and then the prioritization is not effective. And the other thing is that this calculator that calculates the risk sometimes give a vulnerability a high score, although this specific vulnerability have never been exploited. There is no malware out there that use this vulnerability to attack a device. So I like to work with a different approach, which I call a top-down approach. The top-down approach means that let's go out and look at the market, look at the cybersecurity space and understand what type of malware are out there, what type of malware are now attacking other healthcare providers or other organizations. Understand what type of exploit they are using and what kind of vulnerability they are exploiting. And let's start with those risks. And by that, we'll be much more ready, or once we will be attacked by that kind of a malware, we will be ready for it. Jennifer, let's move to our next question. This is something that really interested me to know. What is your perspective on that? From your experience, when it comes to mitigate device risk, what type of actions have you used? And this is based on your experience. So we have hardened the device configuration, update the software. We've used the network policy tools to limit the device communication. C, we did both. We hardened the device configuration and configured the network communication rules, or we have not taken any actions till now to secure medical devices. Jennifer, let's give them another 10 seconds and close the poll. Obviously. The best way is security is built with layers. So the best way is to treat the device and also close all the gaps that we have, close all the holes that we have in the network. I really hope that would be the case, but I want to show you these numbers and I want to explain what those numbers are actually, what the meaning of those specific numbers. So looking at the data of our customers and taking all of the devices and do a risk assessment on them, and then based on the risk assessment, building the action plan, like really build a list of all the actions that they can do on each device and each risk. When you are taking all of those actions and you are looking at them, you see that only 30% of those actions can be done on the device level. And this is something that I've heard from many biomed team, from customers, biomed team that we had, that they were saying, like, in a lot of cases, we don't have anything to do. There's no advisory from the vendor, and there's nothing really that we can change on the device level because we don't want to lose the warranty of the device. So only 30% of the actions that we can do will be on the device itself. It can be changing the device configuration or update the credential on the device, or maybe patch or update it if there's such a patch available. And actually, 70% of the things that the customer would be able to do are things that are actually on the network level, which lead us to the focus of this webinar, which is the concept of zero trust. So I want for a few minutes, leave aside the medical devices and move a little bit to the security world and talk a little about security. We'll get back to the medical devices in a few minutes. So what is zero trust? Let's talk a little bit about zero trust and understand what is zero trust and what's the idea with zero trust. So if we're trying to just explain it in few words, it's trust no one, verify everything. So that's in really high level. And let's understand where zero trust actually came from. So in the past, we were really naive. Life was really naive. We had simple networks. Attack vectors were really simple. And in order to define trust, we said everything within our network can be trusted. Everything which is out of our network, we cannot trust it. So we needed to define the perimeter of our network. And once we defined the perimeter, we put a firewall on the perimeter and we said everything in is good, everything out is bad, and everything was really simple, or we thought it's simple. But today, networks are much more extremely complex. So today there are new services, cloud services, remote work. People are connecting from home to their work. This is actually was getting accelerated while COVID-19. There are new privacy regulation around protecting personal data even within the network itself. There's the bring your own device. Mobile devices are connected to our network, and also malware exploits have become much more sophisticated. They are using techniques like social engineering to breach to cause one employee to open a specific document and infect his machine, and from there they're actually moving across the network itself. So the perimeter, which we thought can define what can be trusted and not what cannot be trusted, is not valid anymore. We cannot use the perimeter or the firewall to define trust. So how do we define trust when we're talking about security? So if you want me to trust you, first of all, you need to prove your identity. And we call it in security authentication. You need to authenticate yourself. And how can someone authenticate itself? So probably you know all of it, but this is something really common in security. Something you know, this is a password. You should not share your password, guys. This is something that you need only to keep to yourself. Something you have, so usually there is some kind of devices that can generate a token and you need to type in the token. This is something you have. Something you are, biometric, you put your finger and you authenticate yourself, or something you do, which is the way that you write your signature or type on the keyboard. So you need to authenticate to prove that you are the right person. And then once you've been authenticated, then you need to be authorized. What does authorized mean? So think about it. There are two persons, both of them authenticated, but one is the admin, the other one is a user. So the user only needs to get permission to read the data. It doesn't need to change anything. And the admin need permission not only to read the data, he need also to write data. So we want to make sure that once the user is being authenticated, we are only authorizing him to do the things that he needs to do for his work and not more than that. And this is what we call the least privilege permission principle. And this is something that is very important. We'll get to that once we talk we'll talk a little bit about the security access. So what can be authenticated? I'm still not talking about medical devices. We'll get to that in a minute. So what can be authenticated? We can authenticate users, we can authenticate application, and we can also have authentication on the network level. But we have a problem. Medical devices and legacy medical devices do not support device authentication. So we cannot really apply an authentication mechanism on those devices. So how can we, although they don't have it, how can we still try to do some kind of authentication of those devices? So the way that we do that will be using network access control lists. And before understanding what is a network access control list, let's understand a little bit how connection work on an internet and on the network, and specifically an environment of TCP IP protocol. So in order for one device to connect to another device, one of the devices need to play the role of a server, which is running some kind of a service, and is actually listening on a specific port. It's listening for connections. And also it have an address, an internet. It have a network address, which we call the IP. And then we need another device, which play the client. And the client is the one that initiate the connection to the server. And he also have an IP address on the network. So in order to define a connection between two devices, we need to have the source IP, which is the client side. We need to have the destination IP, which is the server side. And we need to understand the port that the client initiate the connection to. So this is the way that two devices connect to each other. And if we want to define the network access list for those two devices, we actually need to define those things. We need to define what type of the communication the device is permitted to transmit to which servers and which ports. And we also need to define what type of communication the device can receive on his ports. And by defining that, we are actually defining what we call network access control. Sorry if I've been too technical, but I think it's really important to understand the basic of that. So why network access control are so important? So I think the idea, and I love this animation, if our network were flat, everything can talk with everything. Each device can do any connection to any other device on the network. Once our network will be breached, then the malware can easily move from one device to another. We call it lateral movement within the network. But if we will take our network and we will break it down into small pieces, and we will take each piece of the network and we'll put those network access control lists on them, then we will define what is allowed to be, what type of communication is allowed from this specific segment and to this specific segment. And by that, we are actually containing the malware from spreading from the IT devices to our medical devices. Remember, once our medical device is being hit, to replace it, it will cost us a lot of money and the vendor will not help us. I saw it in your answers. So what I want you to understand from that, and this is, I'm sorry that I'm simplifying it, maybe it's too simplified, but I want you to understand that network access control will help us do zero trust for medical devices, and the security guys call it network segmentation. Let's move to another question. So does your organization has separate network segments for medical devices? A, yes, medical devices have their own segments with access control list. B, yes, medical devices have their own segments, but there's no access control list defined for these segments. C, no, medical devices are share the same segments with other type of devices. And D, I don't know. Jennifer, let's give 10 seconds and close the poll. That's awesome. 70% have their own segments with access control lists. This is really surprising, but really nice. It means that you know what you're doing. So how can we accomplish the zero trust network access control? How can we accomplish it? So in order to accomplish this, we need to understand how our device is communicating. And medical devices have many types of communication, starting with IT protocols. Eventually, those devices are running usually on top of an operating system, a standard operating system. This can be even Windows operating system, and they need to use standard IT protocols. Obviously, they need their medical protocols. And medical protocols, you have standard protocols and you have proprietary protocols. Probably you know it that vendors are also usually for some devices need access to those devices. Sometimes those connections goes from the vendor to the device, and sometimes the device is the one that initiates the connection to the vendor, and in order to help you support those devices. As I said, those devices are running OS operating system, and the OS itself have its own needs for connection. And we have cloud services. So there are many, and there are many more type of connection that medical devices actually do. And we need to understand that, and we need to profile the device communication. We like to classify it or categorize it by 3 types of communication. We call it east-west communication, which is it's actually communication that is happening within my network. North-south communication, which is actually communication that is from our network to an external network. And we like to subcategorize this north-south connections into the vendor access connection, which is specifically connections that the medical device do to his vendor, back home to his vendor. So what is our goal? What do we want to achieve, and how do we do that? So what we need to do is we need to take group of medical devices that have the same network behavior, the same profile of network behavior, and we want to group them together because we want to provide them with an access control list that will fit their specific requirement of communication. And here we go back to the idea of least privilege. If we will take 2 devices that don't have the same communication pattern and we'll put them in the same group, we will need to have a much longer list of communication rules, those access control lists, because one device needs his own set of rules and the other device needs different rules, and the list will be really, really long. And this is not following the principle of least privilege. We need to make sure that the devices that we are grouping together have the same behavior, and the list that we were building for those devices will be as short as possible, because we also need to maintain it and be able to work with it and understand it. And how do we do that? And this is maybe easy to say. I think it's much difficult to do it in real life. So first of all, we have many types of devices, and we need to take each type of device and each model of device, and we need to look in the vendor specification and understand what kind of communication the device needs to do. And it's not only that, we also need to understand how the device was configured specifically for our environment and what type of communication it needs to do in our network. Once we've done that and we profile the device communication, then we need to start identifying and grouping those devices together, understanding which device needs to be with other device in the same group. And after we group them together, we need to calculate the list of the access control list, which type of communication is allowed from this group to the other segments, and what type of communication is allowed from those segments back to this specific group. Now, we are working in the healthcare vertical. We cannot afford ourselves to make mistakes. There is patient safety that we need to make sure that we are not affecting the operation of those devices. So we need to do some kind of a validation to those ACL. We need to try to do some simulation of those rules against real traffic to understand that those rules that we've defined, there's no mistakes, and we know that we can be sure and have the confidence that we can take those rules and eventually push them to another tool that we have on the network, like a firewall or a NAC. NAC is another tool that we have on the network that can enforce those access controls. So we can take it and push them to those tools in order to enforce it. And we need to make sure to validate it and test those policies before we're enforcing them. Jennifer, we are jumping to another question. Does your organization use a network solution to analyze medical device communication? A, yes, the solution is working great for us. B, yes, we have a solution, but it's not specifically for medical devices. C, no, we do not have any solution yet. And D, I don't know. Let's wait for a few seconds and close the poll. have a solution, but it's not specific for medical devices. So this is really important. Understanding, one of the things that we here in Cynerio have seen is that regular IT tools are not, cannot recognize or understand the type of communication a medical devices is needed, and this is one of the reasons we founded this company. So this is not a one-time work. Once you do it, you cannot just calculate it, finish it, put it everywhere, like enforce it, and you will be done. No, this is an ongoing job, and since this is an ongoing job, you need to have a tool that can automate it and can orchestrate it by pushing the rules and checking, testing the rules, and understanding if there are problems with the rules and fixing the rules and all of those things. So when we are talking about implementing zero trust, it's really difficult, I think almost impossible to do it manually. You have to have some kind of a tool that will help you automate this process and also orchestrate it across other devices, integration with other devices that enforcing those type of access control lists. So I wanted to tell you a little bit about our company, Cynerio. So as I said, we've recognized the pain of medical devices. We understand that a medical device that is being compromised, it's not just loss of data or service disruption. We understood that there is a patient behind this medical device, and the patient can be injured or even dead. And based on this understanding, we've launched our product in 2019. We launched our product, and we're really happy because, for example, Gartner have entitled us as the cool vendor in this space. And in the last Forrester Wave report, we were announced as the leader in this space. We're really proud with our solution. So I think we have time for a short demo. The product is really have a lot of aspects, but I will focus specifically on the zero trust. Let me close the camera because I'm looking on a different screen. Okay. Let's see if that will be easy to move to the demo. Awesome. Great. So we are in the demo, and we have about 5 minutes. So this is our product. This is our solution. What you see over here, this is the dashboard. A few words about the dashboard. Our solution, we understand that there can be many people that would like to look at the data. So we built the dashboard in a really way that you can configure it any way you want. You can create your own dashboard. You can create your own private dashboard, and the dashboard is built by many type of widgets that provide many type of kind of information, and you can build it and do whatever you need in order to help you do your work. I've specifically built here specific for biomed. This is a nice view that I always like to see. You can see here all the types of devices that you have in the organization, and you can even understand the risk on those devices by the bar underneath the icon. You can see also that the dashboard can be filtered by sites or by IoT or IoMT. I believe that you probably filter your dashboard by IoMT because you own the medical devices. And I want to jump, and I'm jumping straight to the mitigation. I'm jumping on the inventory and the risk for a second, and I'm jumping straight into the mitigation. So you can see that we are actually building the list of all the actions that you can take on all of the devices. And if I'll click here, you would see that the actions are actually split between things that you can do on the network and things that you can do on the device itself. And if I'm going into the east-west segmentation, you can see that we are taking the network map and we are actually building a list. We are grouping the devices. We are doing all the heavy lifting, where we understand what is the profile of the device communication. We understand which device needs to be grouped together, and we are calculating the access control list specifically for those devices. You have here the list of segments, and you can just navigate between them on the map, and you can see them. So let me specifically right now, I've prepared a one of the policies. Let me just drill into it. So I'm going into the segment, I'm going see policy, and I have a specific dashboard to show me that specific policy. And remember, we spoke about the access control list, so I need to show you that as well. So for example, you can see here all, remember, there is a destination and source IP. We have, if this is an inbound and outbound communication, we also have the port. We even provide you more information regarding the protocol and what is the purpose of this specific connection. And if we're looking back in the dashboard, you can see, for example, which devices are currently in the group of the devices. And let me just drill into those 18 urinal analysis devices, and I will drill into one of them. And you can see, for example, when we are providing the inventory of the devices, we're also able to provide you the OS, even the software version of a device, and sometimes also the serial number of the device. You can see that we are also providing the serial number of the device, and we are providing a lot of information on the devices themselves. Let me talk a little bit about the way that you are pushing the policy into the your network. So back to the policy screen and back to the lab devices policy. So one of the things that you can see here, once I'm enabling the policy, we are starting to do a validation process, meaning that we are simulating those rules, these rules, against the real traffic. And we are checking if this policy is being violated. If it is, we are giving you the tools, and maybe I'll even show this as well. Let me jump to a different policy that I've prepared in advance that have violation events. Okay, so this is a surgery and radiology device segment, and you can see over here that there are 5 violation events logged. I can click on view the violation events, and you can see that I have here all the details that I need in order to understand what type of communication violated my policy. Now, it's either I'm looking this and looking specifically on this communication and understanding that this specific connection needs to be part of the policy. I can just right click it and add it to the policy, and I just added another line, another access rule into my policy. Or I can look on those specific violation, and I understand that I need to fix something in the configuration of the device, and I can go to the device, fix it so the device would not initiate any new such communications. Once I do that, I can reset the events counter, and you can see that right now the policy moved from a violation state to in progress to validate it again. So I can, again, once it is being validated, in this case it's 20 days, and you can define how many days you want to test this policy. Once this policy is being validated, then I can move to the enforcement phase using integration with a firewall or NAC and push those rules to my firewall or NAC. So I think I've covered a little bit about the product and talked a little bit about Zero Trust. And let's move to the Q&A phase. Jennifer?
Thank you so much, Micha, for all of this valuable information. As a reminder to our audience, if you have a question, please use the questions feature on your webinar dashboard. We do have a few questions that have come in already, so we will start with those. Our first question is, are some medical devices more vulnerable than others, and how do you determine what to secure first?
Great question. So obviously there are some medical devices that are more vulnerable. Usually those devices are devices that are running legacy operating system. And the reason for that is because there's no updates for those devices, and we don't have anything to do from the device level perspective, where there's nothing we can do with the device. Only from the network perspective, we can try to put some, what the idea of network access control tools is to put compensating control on this device in order to mitigate the risk. And the second part was, forgot, just remind me the second part of the question. What we can do with it, or which one you want to start first. So remember I spoke with the bottom-up approach and top-down approach. My advice to you is to look around, understand what type of attacks there are in the in the space, understand what type of exploit are being used, and understand the relative or the relevant vulnerability of those exploits, and start with those, because once you'll get hit with those kinds of popular malwares, you want to make sure that they are blocked from moving within your network, because you already covered those specific vulnerabilities.
Thank you. Our next question is, we already have an asset management system and it's updated manually. Can your solution update it automatically?
Sure. So the whole idea of our product is that it's fully automated. We see the traffic, we understand the devices, and the information that we are displaying in our console is the most updated information, the most updated data. And we have integration with asset management system, and we can feed this information into this asset management system, so you will have the most accurate and updated data within your asset management system.
All right, great. Our next question, Micha, is, can you give a rough estimation of how long it takes to segment a network?
Okay, so it's really depending if you're using a tool or you're not using a good tool to do that. If you'll try to do it manually, I guess it will take you months to do that, and also to maintain it. I think you have to have a tool that will help you. I can tell you from experience that I have with our customers, taking our solution and implemented it, you can you can start your segmentation product, like start being effective after few months, like 2 to 3 months. You can start being effective, and in a year time you can segment the most important medical devices that you have in your network, which I think it's really quick by understanding the amount of information that you need to analyze in order to do that.
Thank you so much, Micha, for all of your time today and for a great presentation. I would like to encourage everyone in the audience to visit today's sponsor to learn more about the services they provide to our industry. Please visit cynerio.com. A quick reminder that you can obtain your continuing education certificate by completing the post-webinar survey. The survey will be emailed to you 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE credit from the ACI. You'll be able to download your certificate immediately after submitting the survey. If you have any questions, please contact us at webinar@mdpublishing.com. We'll be back soon with another webinar. Please visit webinarwednesday.live for our webinar schedule. Thank you, and we'll see you next time.